Shock. Shock is a condition of circulatory failure and impaired perfusion of the vital organs. This impaired perfusion, that means oxygen and fuel are not getting to the organs, so we end up with hypoxia and impaired cellular metabolism and acidosis, and eventually, if this is not fixed, we end up with cell death. There are different types of shock. The first one is cardiac shock, and that's just because the heart is not pumping effectively. The second one is the one we think about most frequently when we talk about shock. That's hypovolemic shock. And that's because there is a decreased blood volume, like a massive hemorrhage. Then we have septic shock, neurogenic shock, and anaphylactic shock. All of those are caused by a massive systemic vasodilation. Regardless of the type, the body responds in similar ways to try and compensate. Let's go back to the blood pressure formula. Blood pressure equals cardiac output times systemic vascular resistance. Now this first chart looks a little busy. We're going to break it down, but let's look at the first line. Impaired perfusion. Remember, we just said impaired perfusion is going to lead to hypoxia and acidosis. From there, we have central nervous system stimulation and the renin-angiotensin-aldosterone mechanism stimulation. So let's go down the left side of the page first. Sympathetic nervous system stimulation. That's part of the autonomic nervous system, and we're going to break this box down further into two other boxes. So the sympathetic nervous system stimulation, we see vasodilation to the brain and the heart, and vasoconstriction to the other organs. Well, that means we are protecting the brain and the heart. Those are the two things that absolutely have to keep going, have to have a good oxygen supply for the rest of the body to stay alive. So the blood is shunted to those areas. The other thing the sympathetic nervous system does is it increases heart rate and cardiac contractility. So the heart beats faster and it beats stronger. Both of those mean we have a higher cardiac output and an increase in blood pressure. Now let's go down the right side of the chart. Impaired perfusion, hypoxia, acidosis, and then stimulation of the renin-angiotensin-aldosterone mechanism. That's going to cause vasoconstriction, sodium and water reabsorption, and therefore we're getting an increased intravascular volume. That too is going to increase cardiac output. Remember, when we increase the vasoconstriction, that's increasing the systemic vascular resistance. So we end up with increased cardiac output, increased blood pressure. So here we go with the whole big chart again, seeing how all those things fit together. Now what if this doesn't work? What if the heart's too weak and it can't get stronger and it can't beat faster? Or we don't have enough blood volume to be able to adequately constrict and make up the difference. We end up with decompensation. So there's a drop in cardiac output. And if we follow the left-hand circle, there's a drop in blood pressure, drop in tissue perfusion. We're not getting, if there's no perfusion to the tissue or little perfusion, we're not getting oxygen there, so we have hypoxia. The tissues are damaged, And because the endothelial tissues are injured in the blood vessels, more fluid leaks out. We have further loss of intravascular fluids, which is going to further decrease cardiac output. So lack of oxygen to the blood vessels damages the blood vessel cells. The blood vessels become leaky, and that's less fluid in the system. So that's a vicious circle there. Over on the right-hand side, we have drop in blood pressure, decreased tissue perfusion. Again, that's going to cellular injury, generally, not just in the blood vessels. But that means the body is switching over to anaerobic metabolism. And we have metabolic acidosis. Well, remember up top, metabolic acidosis is one of the things that started the whole process. So again, this is a vicious circle. It's making the whole shock scenario worse. The outcome of shock, if it is not taken care of, is the cell membranes degrade and rupture, multiple organs fail, and we end up with death. The key to understanding the clinical manifestations of shock is to remember hypovolemia and hypoxia. Not enough fluid, not enough oxygen. So if we don't have enough fluid, we got hypovolemia, there's a drop in blood pressure, the body tries to compensate and increase cardiac output by having tachycardia, increasing the heart rate. We also get tachypnea along with that. Cool, clammy extremities. We're not getting blood there. It's being shunted away. Poor peripheral pulses. And it's being shunted away from the kidneys because of the hypovolemia. Not a lot of fluid is getting to the kidneys. We have poor urinary output. If we're looking at hypoxia, again we see the tachycardia and tachypnea. The body's trying to get as much oxygen as possible and move it around as quickly as possible to the different tissues. We have cyanosis or pallor. And as the brain becomes hypoxic, we see restlessness, apprehension, and decreased mental functioning. Now, shock is an emergency. Remember the ABCs, the airway, the breathing, that includes getting oxygen in. Maybe we're giving them oxygen as part of that. The circulation, think about the cardiac output. So we're looking at fluid volume support, keeping them warm, decreasing the workload. All of this has to do with circulation, having them lie down and lift up their legs. So the blood that is there, the volume that is there, is getting to the organs. The organs are crucial to life. And as always, we try and treat the causes.